Hello, everyone. I'm Alec Farker, member of the Disability and Work Canada Steering Committee. I'm pleased to introduce the following session, Workplace Guidance for COVID-19 Responses and Return to Work, a focus on the needs and experience of workers with disabilities. Thursday, November 26th, 1:15 to 2:15. This is a really important part of our effort at this conference to focus on the very wide and deep impact of COVID-19 on persons with disabilities. This session focuses on workplace guidance for responses and return to work. A lot of work's been done by policymakers, researchers, and other stakeholders to formulate evidence-informed best practice guidance for protecting workers from exposure to COVID-19 as they return to work while the economy reopens. Some of this guidance is designed specifically for various economic sectors. Others is broader, perhaps drawing on existing best practices and standards interpreted with the COVID-19 lens. And what we wanted to do was to present a selection of these efforts with a focus on the needs and experience of persons with disabilities. We're really fortunate to have four very well-informed presenters, and you'll hear from each of them. But we'll start with a vignette, which is a series of essentially experiences of different persons with disabilities that we hope informs the discussion of the complex, sometimes very individualized, sometimes generalized situations that are faced by people as we start to recover from COVID-19 and return to work. So we'll start with that vignette. It's been provided by Megan Kelly of CCRW. Then we'll move to Victoria Arundale. Victoria is an assistant professor, University of Toronto, Dalla Lana School of Public Health. And she, early on in COVID-19, led a Canadian Standards Association project to produce a rapid research report on COVID-19 return to work. It's a really interesting concept, real-time response to real-life situations as they are arising, and she'll be presenting the findings of that research report. Then we'll move to Emile Tampa. Emile is one of our steering committee members actually at Disability and Work Canada. He's a senior scientist at Institute for Work and Health, an associate professor of McMaster University. He's also an assistant professor in the Dalla Lana School at U of T. And what Emile will be doing is telling us about the development of the Canadian Standards Association Z1011 Disability Management Standard and how it might be relevant to the situation faced as persons with disabilities return to work after COVID-19. We'll move along then to Michelle Demery. Michelle Demery is from Accessibility Standards Canada, and she's been involved in the development of guidelines for support of persons with disabilities in light of COVID-19. So you'll see this whole range of work, a couple of CSA projects, Accessibility Standards Canada, and we'll finish off with Megan Kelly. Megan Kelly is from the CCRW. She's their National Manager for Business Solutions, and she played a key role in an Office of Disability Issues funded project on the frontline impact of COVID-19 on persons with disabilities. It produced the vignette you're going to see, and then her presentation will focus on the findings of that project. So she's attempting to ground everything we're doing in the real life frontline situations that people are facing. We hope to have a sufficient time for a good question and answer session and are looking forward to everyone's participation in that. Thank you very much.
Hi, I'm Kyle, and I work full-time as an office administrator. I got in a car accident 5 years ago, and ever since, I've struggled with symptoms from my traumatic brain injury. I find a noisy office environment particularly hard. I worked with my employer for 3 years, and I've tried to ask to work from home a few times, but the answer is always no. Since coronavirus, I've been working from home and it's been fantastic. I've been able to be so much more productive. My boss now understands why working from home might be a solution for some.
Hi, I'm Jan, and I'm a student by day and a bartender by night. I decided not to disclose my disability at work because at the time, it did not cause functional impairments related to my job. Ever since COVID hit, my anxiety has been through the roof. I decided to share these feelings with my boss because I've built a friendship with her over the last 2 years. But I was surprised by her reaction. She wanted a doctor's note, and I just felt completely misunderstood. The problem is, I decided not to get a medical diagnosis because this is the first time it has had an effect on the way I work and how I study. I thought I would be understood.
I have to say that in many ways, sort of the COVID world has been liberating for me as a person with a disability who, uses a wheelchair. There's a lot of sort of on the surface things like it's nice that I don't have to worry about the accessibility of a building. I mean, do they have door openers? Are there stairs? But for me, it's more than that. I don't have to worry about, what's the weather like outside? Is it raining? I have to worry about my wheelchair. Am I allowed to be my support worker? Where are they going to sit? What if I'm not feeling well? Then what am I going to do in a large meeting setting? So there's a lot of things that sort of go through the mind of somebody with a disability when they're working out in community or they're attending meetings out in the community. And using a virtual platform for me allows me to focus on the work. I get to be comfortable in my own space where everything is accessible. And I can be myself and focus on the work that I need to do and not concern myself with the accommodations.
Hi, I'm Chris, and I work in retail at a shoe store. I normally work 40 hours a week as I love to work and I am trying to save up money for university. I haven't been able to work during COVID because my little sister has cystic fibrosis and I don't want to put her at risk. These are interesting times as now everyone needs to be more careful and I feel that she will be more understood.
Hi, I'm Janelle, and I work in the financial sector. I love my work so much, but I also experience a lot of pain, which is why it is so important to me to find part-time work to attend to my health. Most interviews that I went to, well, they only wanted me to work full-time. I now found a job 3 days a week that I share with another colleague, and we complement each other so well. Having these 2 extra days a week where I can rest my body and go to physio have been so incredibly helpful for me. I want to share with the world how incredibly helpful job sharing has been for me.
But for me, this environment is really working. So with vision loss, our office space is a beautifully open concept design, and a lot of people enjoy and are able to really connect with folks in and around the office. Pop in and where everybody is sitting. But for me, this has always been a barrier for me. I'm not able to go around the office and just pop in and see if, I'm not able to see if somebody's sitting at their desk, or I can't just go over here to this person. I don't know where everybody sits. So I've always felt like I've been actually at a disadvantage compared to others because of this. So now working remotely from home, and we use the Microsoft Teams platform, and I'm now able to, connect more with people and have, yes, we're having all back-to-back meetings, and that causes a little bit of burnout, in and of itself. But for me, though, being able to, bounce from meeting to meeting and have a really, engaging conversation with somebody over this, Teams platform really works for me. Plus also, I have all my technology at my desk here. So this actually works more effectively for me to be able to be at my desktop and have my meetings all in one. Because, traveling around in a meeting space with my laptop, this just doesn't work for my disability. It's not the best accommodation for me. So I'm actually at my best, at my desk, being able to connect with people over this Teams platform. So I'm actually having more conversations with people than I ever have before.
Hi, my name is Alex, and I started my new job 1 month before COVID. When the lockdown began, we were all moved to working from home. My background is tech support, so my home-based office was fairly well set up and ready for me. However, I am deaf and depend on lip reading and social interactions. Getting used to virtual team meetings was a bit difficult with the internet connection being slow sometimes. But we now have closed captioning systems in place, and it works really well. What is it like working from home? This year is a bit different, as I am now on my own in my first house. After a few months in lockdown, I had made the decision that it was time to finally purchase my first home after securing a full-time employment. Having my own place and an office setup, I feel very independent and comfortable, but I do miss the interactions at work. I make sure that in my spare time I go out and see my family and friends in my bubble and take some time to enjoy the outdoors. It has helped me stay focused and not feel secluded. Because of COVID, what do employees need to do to be more accommodating for people with disabilities at work? Make sure they listen to their employees' needs. I was fortunate to have a team lead that already knew of my disability and was quick to reach out and make sure I was comfortable and able to deliver my work. I know some people are scared to ask for accommodations, but I would rather ask for the help than lose a permanent employment because of miscommunications.
Hi, everyone. My name is Victoria Arundel. I'm an assistant professor at the Dalalana School of Public Health, and I'm very happy to be here today to talk to you about a rapid research report that we did in collaboration with the CSA group that was set out to summarize the occupational health and safety considerations for reopening and operating workplaces during the COVID-19 pandemic. Although I'm the person talking to you today, this was certainly a very large team effort. We had half a dozen students from the Dalalana School of Public Health working on this over the summer, as well as a very active advisory panel with representatives from the CSA group, as well as the University of Toronto. And we did also receive funding from the MyTax Accelerate program as part of this project. So I'll start by saying that COVID-19 is an occupational disease. It's affecting workers, and the transmission of COVID-19 in workplaces can also affect people outside of the workplace. And so this is a bit unique for a workplace hazard. It also very clearly shows the link between occupational health and public health. Employers that are trying to tackle the problem of COVID-19 really need to consider three broad areas. One is the building itself and how the building systems are operating. The second is how the workspace is designed. And the third is how they're going to support workers' health, both physical and psychological. The recommendation in many aspects of occupational disease prevention really is the layering of controls. You don't want to rely on a single control. And we know from previous work that multifaceted controls do tend to be more effective in preventing occupational disease. The goal with COVID-19 in the workplace is twofold. The first goal is that you want to prevent COVID-19 from being introduced into the workplace. And the second goal is that you want to prevent transmission within the workplace if COVID-19 is introduced. So you're breaking the chain, hopefully earlier rather than later, but you're well prepared if you need to break it later as well. The aim of our rapid research report was to review and summarize the occupational health and safety prevention practices that could support safer reopening and ongoing operation during the pandemic. We did put some limitations in terms of scope. We limited to prevention practices that could be undertaken at the workplace level. So we did not include regulatory or policy level changes that might impact these workplaces. We also excluded patient-facing healthcare and first responders because we felt that these exposure circumstances were unique and really needed to be discussed separately. We set out with 4 guiding principles to this work. The first was that primary prevention should be guided by the hierarchy of controls, as it is for other workplace hazards, focusing first on elimination and then moving to engineering and administrative controls with personal protective equipment as a last resort. We felt strongly that any prevention strategy for COVID-19 should not reduce the effectiveness of controls that were in place for other hazards, and they should also not, as best as possible, introduce new hazards. And that the prevention of COVID-19 should really follow a cycle of continuous improvement, which is critical when we're continuing to learn more day by day and week by week. The approach was one of a rapid research review. So we looked very broadly for anything related to workplaces and COVID-19. We did a summary. We tried to identify areas where there was consistency and areas where there was discussion among experts about particular topics so that we could then take this out for review, and that's just what we did. We did 3 rounds of expert review with subject matter experts, industry-specific folks, and public and occupational health leaders, and we received feedback, either written or oral, from over 60 people as part of this process. So the 3 domains are the ones we started with: building systems, the workspace, and the workers. And beyond these 3 domains, we also found 2 cross-cutting themes that continue to come up again and again. And these are occupational health and safety culture and communication. And there is good evidence that good or positive health and safety culture leads to better outcomes in health and safety. And there's no reason to think that this would be different for COVID-19. So we did want to highlight that. And the role of communication was also critically important in developing and designing prevention strategies and having the meaningful involvement of all workers in this process. More specifically, some notes from each of these domains. When we're talking about the building systems here, we were focused on reducing chemical and biological hazards, not COVID specifically. We do know that heating, ventilation, and air conditioning systems have a role to play in transmission, but the HVAC and the water systems in buildings can also introduce other hazards, and it's critically important after periods of shutdown or when buildings are running at reduced occupancy that these systems be monitored quite closely. In the second domain, around the workspace, here the goal is to reduce transmission of COVID-19 in the workplace, and this is largely done through improving physical distancing and following public health guidelines, increased cleaning and sanitation, hand hygiene, personal protective equipment, or masks and face coverings. In the third domain, to move my window, in the third domain, we are concerned with ensuring the physical and psychological health of workers. And here, these recommendations both prevent the introduction of COVID-19 into the workplace and also reduce transmission within the workplace. And it includes things like monitoring cases using health screening, the need for ongoing and education and training, having policies and procedures in place that ensure equitable accommodations are being used, and that we are supporting the psychological health of workers, and that workers are aware of whatever financial supports might be available in their particular area. This is not something we normally think about in health and safety, but when we're asking folks to stay home when they're sick, we certainly need to make sure that we're also communicating how they can overcome the financial burden that might introduce for people. In terms of workers with disabilities in COVID-19, these threads were woven throughout the report, and it was largely through the expert consultation and review process that we got some really good feedback and examples. But a reminder for us and for everyone was that COVID-19 has affected workers very differently. Some workers have new accommodation needs, and some may have reduced or altered accommodation needs, perhaps as a result of things like this broad work from home acceptance that has happened over the last 6 to 8 months. There is a real need for the prevention strategies that are used for COVID-19 to be inclusive, and communication and inclusion really are critical in ensuring this at the design phase and the implementation phase of these controls. And the example that came up again and again was around masks and the covering of the face impairing lip reading, but also reducing sound levels and making it much harder to hear speech in the workplace, which can also in and of itself be a safety hazard. It's been made very clear from the Ontario Human Rights Commission that COVID-19 is not a reason for not accommodating in the workplace. And I think it's also critical to remind employers that COVID-19 is not a short-term problem. Perhaps you could be forgiven for thinking that back in March or April, but it is here. It is something we are going to need, or we are going to deal with over the medium to long term. And the prevention strategies that we put in place really must be inclusive of all workers. So I will stop there and say thank you very much. My email is here. The list of folks that were very heavily involved in pulling this together are also named, so thank you to them. And I've provided the link to the report on the CSA website. I believe Alec has also provided that to the audience as well. So thank you very much.
Welcome. My name is Emil Tompa, and I'm the Director of the Center for Research on Work Disability Policy, and I'm here today to give you a short presentation about the CSA Z1011, the Work Disability Management System Standard, and frame it around the COVID-19 context. Now, the standard was developed by a technical committee that was chaired by myself. There were two vice chairs, Aminias Danny and David Brown, as well as two CSA project managers, Dina Lopez and David Shanahan. There were also 25 plus voting members and several non-voting members that represented an extensive roster of expertise from various disciplinary and functional backgrounds, as well as representing various stakeholder groups. Now, the purpose of the standard is to provide a consensus-based framework for the management of worker health needs as they arise, both physical and mental health needs, so very broadly scoped. It also includes consensus-based guidance for the recruitment, hiring, and onboarding of workers with disabilities. It was developed over the 2019 to 2020 time period, so prior to the COVID-19 pandemic, but there is guidance within the standard that's applicable to the current context. First and foremost, it takes a worker-centered approach. It really addresses the need to focus on workers' health needs in a proactive basis to address workers' health needs as they arise. It's meant to be generalizable, so the standard is designed to be able to be contextualized for a specific organization. It's applicable to organizations across Canada, regardless of what size they are, whether they're private or public sector, whether they're for-profit, not-for-profit, or regardless of what sector they operate in. As noted, it considers both physical and mental health needs of workers, so broadly scoped. It provides quite a bit of detail on the what, the best practice framework, but it only gives a little bit of detail on the how. It doesn't really give a lot of detail there, though there is some implementation tips provided in an annex. It's framed around the systems approach, and that's in contrast to the traditional approach used to deal with work disability management issues, where traditionally it has been assigned to a person to take over the responsibility of a disability manager and operating possibly under the Human Resource Department or Occupational Health and Safety Department, or even in some cases, organizations farm out the function of disability management. Invariably, such an approach, this traditional approach, is very reactive. Even performance measures look at lagging indicators such as absence days. Whereas in contrast, the systems approach, which is how this standard frames the notion of work disability management, it's proactive, considering roles and responsibilities across the organization, because invariably everybody plays some role in the work disability management system when you take a systems approach. It considers inputs, process, outputs, and feedback. And most importantly, evaluation and improvement are done on a continual basis. That's really critical for the systems approach. Many people ask me what a management system is, so I have a slide here about that. It's meant to be a formalized framework of policies, processes, procedures that are used by an organization to meet its various objectives. It's documented, it's tested, it provides step-by-step methods to ensure smooth functioning through these standard practices. And audits are a vital part of that management systems approach. Ideally, organizations have these kinds of frameworks in place to deal with all their core activities, including work disability management. So the systems approach to work disability management really ensures that there's clarity, consistency, and that these activities are integrated with all the other organizational activities. The proactive concept is meant to address health needs before they are disabling. We often use the term work disability prevention to frame that notion of being proactive and addressing health needs before they're disabling. I mentioned this continual improvement process. This framework here, PDCA, or Plan, Do, Check, Act, is a typical framework on this, based on this continual improvement process, where at the front end, the planning part, you establish improvement goals or objectives. On the do part, you implement that plan. On the check part, you monitor and evaluate to make sure you're reaching targets. You review and take action to improve if you haven't reached those targets. If you have, you start another cycle of Plan, Do, Check, Act. There's some guiding principles that are at the foundation of this standard. First, it's an evidence-informed, data-driven approach that is strategic in nature. It's meant to ensure sound policies and processes. It's focused on inclusion, accessibility, and to promote engagement and belonging of workers. As I noted, it takes a worker-centered approach. It's meant to be supportive, contextualized, and take worker health needs on a case-by-case basis. It promotes accommodation and early return to work that really considers the worker's essential duties within that organization. It also frames it around joint responsibility between the organizational management, the worker and the workforce, and the workers' representative where applicable. If there's a union involved in that organization, they may play a role as well. Legal compliance is the starting point. The standard is voluntary and it's intended to serve as guidance that's over and above the minimum requirements of the law. Another key facet of the standard is that it takes a life course perspective. Disability management is framed around this continuum in terms of managing a worker's health needs at the front end, where they first come into the organization, starting from recruitment, hiring, onboarding, through to job continuity, advancement, and in some cases, eventual departure from the organization, whether they exit to retirement or to another organization. And in this table here, which I won't go into detail, we have those 4 key domains and some details to consider in each of those domains: recruitment and hiring, onboarding, continuity, advancement, and employment exit. So lastly, I want to frame it around the COVID-19 case, but more broadly around how it applies to illness and disease. Now, the standard applies to the management of workers suffering from illness and disease, regardless of the cause. It addresses cases where the worker may be off work for a period of time, and also cases where they stay at work while recovering. It addresses all types of health conditions, but it doesn't give specific guidance on communicable diseases. Though sometimes quarantining may be medically necessary, as is the case with COVID-19, then the disability management principles that are detailed in the standard do apply to that kind of a case. In general, the direction in the standard is meant to protect workers from infection and transmittable diseases. So it really focuses on protecting all workers, not just addressing the worker who may be ill or have a disease. It requires the organization to consider the potential biopsychosocial factors also that bear on a worker's health. It also addresses workers' accommodation and monitoring of workers recovering in order to promote optimal recovery and prevent any kind of relapse or further disability. Lastly, it also addresses appropriate communications with that ill worker, both during an absence and throughout that recovery process. Nonetheless, there are some issues in the COVID-19 pandemic context that go well beyond disability management and well beyond the guidance provided in this work disability management system standard. So that's it for me. I look forward to your questions during the question period.
Hi, my name is Michelle Demery and I'm the Chief Operating Officer at Accessibility Standards Canada. Thank you for having me with you today to speak to you about our workplace guidelines. Accessibility Standards Canada is a new government organization that has as its mandate to develop and revise accessibility standards that may be made into regulation under the Accessible Canada Act, as well as to support research to inform the development of future accessibility standards. In the context of COVID-19, we decided to develop guidelines on best practices to ensure accessibility when working from home and returning to the workplace following a national emergency or public health crisis. These guidelines should be available on our website by late November, and they are the first of 4 sets of guidelines. The others, which were also written in the context of a national emergency, will follow early in the new year and will focus on accessible communications, accessible service delivery, and other barriers resulting from national emergencies or public health crises. Our guidelines are a compilation of best practices, and we sought input from a targeted group of stakeholders that included disability organizations, government officials, industry, and others. All of our guidelines are drafted in plain language and will be accompanied on our website by ASL and LSQ videos. In developing the workplace guidelines, one of the key things that we considered was the importance of providing context for employers and managers who may not be as familiar with accessibility, so that they understand why it is important always, but even more so during an emergency event. So for example, employees with disabilities working from home during an emergency, it's imperative in these cases that they have the same accommodations that they would working in the place of work. So that could include particular furniture or equipment or a particular type of software. However, it's also important to be aware that emergencies can create new or different barriers for people with disabilities. For example, support services could be disrupted or if the scheduling changed. And this, for example, could impact employees' hour of work, and so managers would have to demonstrate flexibility in terms of when work is being completed. The bottom line is really that working from home during an emergency event is different for everyone. It's imperative that employees with disabilities and their managers have regular discussions to identify and remove accessibility barriers so that the employee can work from home. These discussions need to take place on an ongoing basis because needs can change over the course of an emergency. In terms of online meetings and interactions with colleagues, there are a number of tools to make them accessible. So many online meeting platforms offer built-in closed captioning services. ASL and LSQ interpreters can join by webcam, but it's also really important that any platform be tested for accessibility in advance of the meeting and that any accessibility barriers be addressed before the meeting proceeds. When hosting an online meeting, there's some key things that you can do as the host. So you should always introduce yourself and encourage others to say their names each time they speak. You should be muting participants when they're not speaking and checking in with your ASL and LSQ participants to ensure that you're speaking at an appropriate pace. You should also ensure that any documentation that you use is accessible. And when you're speaking to it, state the document name and the page number that you're referencing. In terms of returning to the workplace during an emergency event, our guidelines identify a number of best practices. Some of the things that you need to consider when you're preparing to bring your employees back to the workplace include, firstly, speaking to your employees with disabilities early in the planning process so that you can identify and remove any accessibility barriers from the outset. It's also really important that you communicate the steps that you've taken to support the safety and the accessibility of employees before they return to the workplace, and that any communications must be accessible. So plain language, ASL or LSQ, if that's the employee's preferred language, and having other accessible formats available. Something to consider, for example, for employees with vision loss or who use mobility devices. These employees could face increased risk in returning to the workplace because they may need to touch more surfaces in order to navigate their environment. So managers should consider staggered start times to facilitate physical distancing and cleaning. In terms of hand washing, while it's important for all employees to have access to soap and water and hand sanitizer, don't assume that everyone's able to wash their hands. So again, managers should be speaking to employees to identify the appropriate alternatives and accommodations in these circumstances. It's important to ensure the proper cleaning of the workplace, particularly those high-touch surfaces, such as doorknobs or a photocopier or a shared kettle in the kitchen. In addition to cleaning, though, consider removing those shared objects when it's possible. If it's not possible, the recommendation is that a thorough cleaning take place at least twice a day. But again, it's really imperative to speak to employees. Cleaning products can affect people with chemical sensitivities, and employees are really best placed to identify how they need to be accommodated in these situations. It's also important to keep in mind everyone's accommodation needs when implementing physical distancing practices in the workplace. So for example, people who use mobility devices or a service animal may require more space. Also, physical distancing can be more challenging for employees with vision loss, and they may need more descriptive instructions to gain a sense of the space around them and their distance from their colleagues or clients. Face masks can create additional barriers for people who are deaf or hard of hearing, as well as people with cognitive disabilities, as they muffle sound, hide lip movement, and facial expressions. Using masks with a clear panel can help to reduce some of these barriers. I think lastly, it's important for managers to remember that emergency events can have a significant impact on employees' mental health. So obviously employees should be encouraged to take regular breaks and to practice self-care, but it's also really important to have regular discussions about mental health and emotional well-being with your employees and ensure that they are aware of what resources are available to support them in these circumstances. So that is the end of my presentation. And again, thank you for having me with you today.
Hi, my name is Megan Kelly, and I'm the National Manager of Business Solutions at CCRW. The Canadian Council on Rehabilitation and Work is a national nonprofit organization that has been running employment programs for persons with disabilities across Canada since 1976. CCRW has served thousands of clients over the years, both job seekers and business. And together, we're eliciting change, tearing down barriers, and changing the face of the Canadian workforce. And that word change means more now than it ever has before. The way COVID-19 has impacted our work, our places of work, the way we look for work, and the way we structure our workday has impacted everyone. In April 2020, we asked individuals to share their stories with us in a variety of ways. We collected a COVID storytelling campaign, and there were 5 major themes that came out of this campaign in April and May of 2020. And those themes were art, work, people and connection, time, and home. The stories were of ways that people were embracing the time that they had with each other, finding new time to do the things that they loved, finding new ways to connect with people virtually, embracing the pivot that was happening so fastly. But now, as we see ourselves 6-7 months down the road and at a different place at COVID-19, in different places across the country with how we're interacting and what that means for our communities, that word change means something different than it did in April. Over the course of the pandemic, the workplace has changed. We need to keep accessibility on the agenda. We've gone through many pivots and changes and are still in the midst of uncertainty. And this uncertainty is different depending on where you are in the country. We need to adapt to these new barriers. But do we know what these barriers are? How do we accommodate these new impacts? How has COVID really impacted people with disabilities? While we adapt to the now, and we prepare for the new, it will be important to structure ourselves for success, manage and monitor priorities, and recognize the value in the experiential learning businesses and employees have gone through and emerge empowered. At CCRW, we see workplace guidance for COVID-19 responses and return to work as an opportunity to scan, adapt, review, respond, and support. The future of work. Impacts from the pandemic response, the changing economy, and emerging technologies have simultaneously affected office environments, employment opportunities, and the future of work as we know it. We are experiencing highly innovative workforce that is, in some cases, not all, more flexible in terms of how we work, connect, network, and collaborate. But we must not forget about accessibility while being innovative. Are work from home offices set up with accommodations as an in-office setup? Is the internet connection strong enough for 8 hours of virtual meetings? Is the home environment safe? Are there feelings of isolation? And what is the impact on mental health? These are the themes of what we're hearing now from business and from people with disabilities. We are still in a time of transition. And during this time of transition, business needs to encourage flexibility, agility, and adaptability. Trust is essential for making the future of decentralized working spaces successful. We need to connect and communicate at every level, or people will feel disconnected and they'll disengage. Businesses that figure out how to scale the customization of the employee experience will win. Focusing on diversity and encouraging the dynamic of unique perspective ensures success in the future of work.